I'm Emily Schmidt. I'm the Deputy Director of the Office of Planning, Research, and Evaluation, and it's my pleasure to welcome you to the final plenary session of the 2018 Research and Evaluation Conference on Self-Sufficiency. Thanks for being here with us. Before I make a few closing remarks, I'm going to invite Kinsey Dinan from the National Association for Welfare Research and Statistics to tell us about their next conference. And if you came to Happy Hour on Wednesday, you have a clue about what she's going to say.
Hi, thank you very much. So I'm Kinsey Dinan. I'm with the New York City Department of Social Services. And as said, I'm also with the National Association for Welfare Research and Statistics. And I'm really grateful for this opportunity to say a few words about our organization and our upcoming events. So for those of you who aren't familiar with us, we are a nonprofit association whose purpose is to promote the exchange of ideas about how research and statistics can contribute to the better development and administration of effective human services programs. We have a strong focus on state and local agency researchers and analysts, as well as on researchers from universities, research organizations, the federal government, who focus in their work on state and local government social services programs. And we provide, I think, a really excellent opportunity, as does this conference, for building connections within and across those groups. We've always had a very strong relationship with OPRE, and following their example, our conference, our in-person conference, is now biannual, being held on alternate years with RECS. So our next conference will be in July 2019. And yes, as you may have seen at the Wednesday evening reception, we're going to be in New Orleans. And we hope that you will all join us there and that many of you will also present your work there. It's a very participatory conference. So to ensure that you get the call for proposals when that comes out, please join our mailing list. We have a list outside on the table near registration. You can also go to our website at nars.org or just give me your email address. Signing up for our listserv will also ensure that you hear about our upcoming virtual event series that I know I'm really excited about. It starts in just a couple weeks. The first event is going to be on June 12th. It's a webinar on communicating with data, visualizing data in the public sector. It's sponsored by the Urban Institute, and it's free to all who register. You just go on our website to register for that event. It'll be followed by two more virtual events. The first focused on human-centered design for social programs, and the second on the changing world of work. So I think, really exciting and timely topics. So again, join us in the coming weeks and months, and then please join us in person in New Orleans next summer. I know I've really enjoyed these past few days, and I'm excited about getting together with all of you in a year. Thanks.
Thanks, Kinsey. So before I invite our plenary panelists to come to the stage, I'd like to take a moment to thank everyone for being here, both those of you here in person and those who have joined us virtually for your attendance at this 19th Research and Evaluation Conference on Self-Sufficiency. And I hope you've really enjoyed the last 2 days. We hope you'll stay connected with us in the time between now and then our next conference, and there are several ways to do that. You can sign up for the OPRE newsletter, and I really encourage you to do so. It comes out every 2 weeks. And it's a way to stay up to date on the latest publications, grant announcements, and upcoming events sponsored by OPRE. You can sign up right now. If you've downloaded the RECS mobile app, there's a link where you can sign up for the newsletter, or on your way out, you can stop by the information desk that's right out there, and Derek Joyner, our dissemination associate, can help you sign up. You can also stay connected to us via Facebook and Twitter. There's also information about that in the app, in the program book, or you can stop by the table and we'd be happy to help you connect with us. OPRE puts out a lot of information. We publish 1 or 2 reports almost every week, and you don't want to miss a single one. So please sign up to keep in touch with us. And of course, we look forward to seeing you at our next conference in 2020. Some final housekeeping announcements before we move on. So after this morning's plenary session, this is our last time all together, but we'll have one more series of breakout sessions starting at 11:45. And you have a lot of great choices, ranging from presentations from the Family Self-Sufficiency and Stability Research Consortium Scholars Network to an overview of a systematic technical assistance process called Learn, Innovate, Improve, or LI Squared, There's several other great sessions, and I hope you'll stick around and attend one of them. We have a conference evaluation. The conference evaluation is available online, and you should have received a link this morning to complete the evaluation. We take this feedback very seriously. We read every single comment that you provide, and we use it to improve the conference in the future. So please do share your thoughts with us. If you would like a conference presentation, if you saw something and you'd like to get the details or see the text in a little bit of a bigger font, you can download it from the RECS mobile app and then email it yourself. Or you can also email our impact team. The email address is in the program book, and you can request any presentation. And we'll also make videos of the sessions that were live streamed available later this summer, and you can get notified through the RECS email listserv when those are available. I want to say thank you again to the many people who made this conference possible. Thank you to the Renaissance Hotel staff who have done a really excellent job of taking care of us over the last few days. Thank you also to our AV and live stream techs. They're seated in the back, and they've also really made sure that everything went smoothly from a technology perspective for us. Our conference logistics contractor, Impact International, has been behind this conference for the past several years, and they do an amazing job at coordinating all of the logistics, make sure we all know where we're going when, and we're really grateful for all the support they do behind the scenes to make this conference work. And then one more thank you to the OPRE staff who put this conference together. It's a tremendous effort to do this. They do it on top of their normal workload, and it's been a great success. So thank you to Mark Butello, who's the director of our Division of Economic Independence, Tiffany McCormack and Amelia Popham, who led the conference team, Victoria Kabak, Lauren Deutsch, Gabrielle Newell, Catherine McKinney, Derek Joyner, and Elaine Carpenter, who did a lot of work to give you the experience you've had over the past few days. So now I'd like to introduce our final plenary session. You'll be hearing findings from the Parents and Children Together experimental evaluation of 6 healthy marriage and responsible fatherhood programs. So I'd like to invite the panelists to come to the stage while I introduce the plenary moderator, Robin McDonald. Robin is the Division Director of State and Territory TANF Management within ACF's Office of Family Assistance, or OFA. OFA administers several key programs, including the TANF program and the $150 million Healthy Marriage and Responsible Fatherhood Discretionary Grant Program. As the Division Director, Robin oversees the implementation and oversight of the Healthy Marriage and Responsible Fatherhood Program and the provision of technical assistance to the grantees and states and territories on state and tribal TANF-related issues. OFA's programs foster economically secure households and communities for the well-being and long-term success of children and families. Robin has enjoyed a broad career in the nonprofit community as well as in the legislative and executive branches of the federal government. She holds a Juris Doctor degree from the George Mason University School of Law, is a member of the Maryland Bar, and has a Bachelor of Arts degree in Mass Communication, Speech, and Broadcasting from Anderson University. Welcome, Robin, and she'll introduce our panel.
Thank you very much, Emily. I've forgotten most of all of that about what I've done. Good morning, everybody. I have to tell you that I was truly humbled when asked to serve as moderator for this plenary because, after all, this is RECS, right? So it's the premier research and evaluation conference ever, right? And so knowing all of that, it makes me just a bit of a nervous wreck. They didn't tell you about the puns? Oh, okay. But I'm also thrilled to still be around to introduce these exciting impact findings on a select group of healthy marriage and responsible fatherhood grant programs. It has indeed been my privilege to oversee HMRF since its inception back in 2005. And through 13 years and 3 rounds of grants, we've funded hundreds of public and private organizations, community-based organizations, to foster and strengthen healthy family formation, improve father engagement with their kids, and galvanize communities, as well as look at the overall well-being of including economic stability and mobility among our participants. You know, healthy marriage programs were able to provide services across 8 specified activities from the authorizing legislation, but generally, healthy marriage provided workshops that focus on improving couples' relationships and teaching skills like healthy communication and conflict resolution. And for responsible fatherhood, there were 3 specified activities, and responsible parenting, healthy marriage and relationship, and economic stability. But finally, after all of that, today, we get to tell a new story. Our story of the power, the impact of programs that we've been doing for these past 13 years, and the power of partnership. A marriage, if you will, between strong program design and implementation and evaluation. And that union gave birth to impacts that will allow us to know and understand more about what works and why. So indeed, learning and evaluation have been woven into the fabric of HMRF since its implementation, and in allowing us that opportunity to learn and to grow. And to accomplish this, we at the federal level actually nurtured a healthy relationship between the program office, which is the Office of Family Assistance, and ACF's research office, which is the Office of Planning, Research, and Evaluation. And our relationship is actually more than just mutually beneficial. We see it as being very beneficial to the people that we serve because we integrate what we learn whenever possible. Now, as you know, back in the 2000s, we conducted impact tests and found mixed results for effectiveness of a select number of healthy marriage programs. And although we didn't conduct impact evaluation research on responsible fatherhood programs, we did conduct implementation studies, and that also contributed to our knowledge base. But we didn't stop there. So we took that information, OPRE actually took it back to their lab where they have all their indicators and their logic models and their Google machines. And what happened was all this turned into the development and implementation of Parents and Children Together Evaluation, or PACT, and the impact findings that we're going to share with you in just a few minutes. Now, obviously, my description was an oversimplification, to say the least, of what has actually happened. So we have a panel of experts who will guide you through the findings. They'll give some of their perspectives, and then we'll take some questions at the end. Now, you can read their full bios for yourself, and so I'll just do a little bit of brief introductions. First on the panel will be Sara Avila, a senior researcher at Mathematica Policy Research, and she will discuss the PACT findings themselves. Dr. Avellar has over a decade of experience evaluating healthy marriage and responsible fatherhood programs. After her will be Mr. Halbert Sullivan, and he will discuss responsible fatherhood findings from his perspective. He is the founding president and CEO of Father Support Center in St. Louis, and which is one of the responsible fatherhood programs that was evaluated under PACT. And they are a 3-time recipient of fatherhood funding. Following Mr. Sullivan, Dr. Scott Wetzler will discuss healthy marriage findings from his perspective. He is the vice chairman and professor in the Department of Psychiatry at Montefiore Medical Center and CEO of University Behavioral Associates, that's in Bronx, New York, and one of the healthy marriage programs that was evaluated under PACT. And his organization actually is also a multiple recipient of healthy marriage and responsible funding. And finally, Dr. Wade Horn will discuss both sets of findings. And most of you know that Dr. Horn served from 2001 to 2007 as Assistant Secretary for Children and Families at ACF within the Department of Health and Human Services. And he led the initial implementation of HMRF programming back in 2006, which is when I had the honor of working with him. Now, currently, Dr. Horn is Managing Director at Deloitte Consulting and overseeing several important initiatives there. And he was also co-founder and former president of the National Fatherhood Initiative. So with that, we're going to get started. Sara, come and tell us about PACT and what you found.
Good morning. I am so pleased to be able to present the PACT results today. My name is Sara Avila, but of course I'm representing the work of a much larger team. My colleagues' names are on the screen who helped with these PACT impact reports. And of course I also want to thank ACF who supported PACT as part of their broader learning agenda of how to best support families. All right. So PACT is a very complicated multi-component study. We included responsible fatherhood grantees, we included healthy marriage grantees, and there are multiple studies of each of these types of grantees. We have descriptive research and we have the impact research, which is of course the focus of today's presentation. But I just want to say that we have reports out on these other components of the PACT studies, and I hope you will look them up. They are on the OPRE website and Mathematica's website as well. So I want to just give you a heads up that I am going to be giving you a very whirlwind tour of the PACT impacts. We have a fantastic panel and we want to leave enough time for discussion and questions. So I'm going to be going pretty quickly, but of course there will be time for questions at the end. So Congress has funded responsible fatherhood grantees for over a decade. And ACF requires that their RF grantees offer comprehensive services. As Robin said, the grantees must offer services in 3 areas: responsible parenting and fatherhood, healthy marriage and relationships, and economic stability. And so that could include things such as employment services. We had 4 RF grantees in PACT, and we owe a huge debt of gratitude to them as well. Their hard work and willingness to learn, of course, make PACT possible. Our 4 grantees were Connections to Success, Father Support Center, Goodwill Easter Seals, Minnesota, and Urban Ventures. So each of these grantees offered those 3 core services that I mentioned. They also offered what we call personal development services. This wasn't a requirement of the grant, but each grantee thought it was important enough to offer these services to their fathers. And personal development services could include things such as goal planning, dealing with stressors, and you can imagine how this would reinforce the skills of those other components. The 4 programs offered one of 2 basic approaches to their service structure. We called the first one an integrated cohort approach, and that was used by Connections to Success and Father's Support Center. And in that structure, a cohort of men started a workshop at the same time, and that workshop integrated most or all of that core content. So it covered parenting, economic stability, and healthy relationships. The other type of service approach that our grantees used was an open entry model, and that was used by Goodwill Easter Seals, Minnesota, and Urban Ventures. And what they did is they offered a menu of services, and fathers could select what services they wanted to participate in. They could select the order, though they were encouraged to start with parenting services. So our primary research question was, what are the effects of these programs? And they were, because the services were comprehensive, there could be effects in quite a range of areas. We had a large sample, over 5,500 men enrolled in the PACT evaluation. When they enrolled, they were randomly assigned to either receive the fatherhood services or to a controlled group that was not offered the services. Each grantee, though, gave the fathers a resource list of other services in their community, and they could choose to participate in those. We had 3 data sources for our impact study. When the fathers enrolled in the program, they called Mathematica, and a trained interviewer conducted a survey over the phone. Our interviewers then followed up with the fathers, each of the fathers, 12 months later, about on average. And then we also had administrative records from the National Directory of New Hires, the NDNH. And NDNH has data on employment, earnings, and other outcomes. We spent a lot of time thinking about what were the key outcomes, the key measures of the program's effectiveness. And our team, before we started the analysis, sat down and met with experts, we talked to the grantees, and we came up with 15 outcomes, which we call the confirmatory outcomes, as the key tests of the program's effectiveness. So these 15 outcomes were in 4 areas: parenting, healthy relationships, economic stability, and well-being. And you can see that they map very closely to the services I just described. So just to give you a very brief snapshot of the men who are in our study, they were about 35 years old on average. They had 2 to 3 children. About 77% were African American. Most had worked for pay in the past 6 months, 71%, but then a sizable proportion had longer term unemployment of at least 6 months. And a little less than half had children by multiple mothers, so some complicated family relationships. And so I will now dive into the RF impacts. So improving the quantity and quality of fathers' parenting was central to all of our grantees, and we found favorable effects on several measures of parenting. Fathers reported more engagement in age-appropriate activities with their children. And of course, that activity depends on the children's age, but it could be something like reading books with your child for a younger child, or helping children with homework for older children. So the fathers who were offered the program had a higher frequency of these types of activities with their children than fathers who were not offered the program. Fathers also reported increased nurturing behaviors, these warm parenting skills, showing patience with the child, encouraging a child to talk about his or her feelings. So the programs had a favorable impact on these nurturing behaviors. The programs did not have an effect on all of the parenting outcomes that we looked at. They didn't affect the father's in-person contact with their children. Our fathers actually had a pretty high level of in-person contact at the beginning of the study, but it didn't improve, the programs didn't improve that over that year. The programs didn't improve financial support, the father's financial support of their children, and that was both formal child support as well as informal child support. And it didn't improve the father's nonviolent discipline of their children. So that's using techniques such as explaining why something was wrong or taking away privileges. But fathers in the program and the control groups were similar in the level of discipline they used. The programs all offer these healthy relationship services. We looked at their co-parenting skills because not all the fathers were in a romantic relationship, and they weren't always involved romantically with the mothers of their children at the time that they entered the study. So we looked at their co-parenting, how they worked together with the mothers of their children to raise their children. And we found that the programs didn't have an effect on the measures of co-parenting that we examined. That included being a good co-parenting team, having a positive co-parenting alliance with the mother of the child. And then we also looked at conflict behaviors. So how do you manage conflict? You could be positive, where you work to solve solutions, you have compromise, or it could be destructive, which is name calling, contempt, criticism. So we looked at both types, but the programs didn't affect either type of conflict behavior. Economic stability was a huge component of these programs. As I said, many of the fathers were quite disadvantaged. So we looked at 2 measures of economic stability. The programs did not have an effect on fathers' earnings. That includes fathers' self-report as well as the administrative data records. The programs, however, did increase the length of time fathers were continuously employed. So we looked at each quarter of employment for a year after they enrolled to see how many quarters in a row they were working. And there was a favorable effect on that measure of continuous employment. You can see here that fathers in the program group worked a little more than 2 quarters on average continuously, and fathers in the control group worked a little less than 2 quarters. We looked at what measures of well-being, the social and emotional well-being. There wasn't an effect on the measures that we examined, and that included depressive symptoms as well as something that's sometimes known as locus of control, whether you feel like you can affect your outcomes or the outcomes of your life are sort of out of your control. And the program and control groups had similar levels of both depressive symptoms and locus of control. So there wasn't an effect on those measures. So just to very briefly recap, we had favorable effects on parenting. And I think that's really noteworthy and important, because these fathers were often not in a position where you might think they would be able to take advantage of these parenting skills and really be able to focus on them and internalize them. They often did not live with their children. Most of them were not in a romantic relationship with the mother of their child. And yet they were able to improve their parenting. They engaged with their children more. They were warmer with their children. So I think these are important accomplishments. The programs didn't affect co-parenting, as I said, and they did lead to this increase in employment stability. However, that didn't translate into either an increase in earnings or improved financial support of their children at 1 year later. And so with that, now I'm going to move on to healthy marriage. So we had 2 healthy marriage grantees, and of course we are grateful to them as well for their participation. We worked with University Behavioral Associates and El Paso Center for Children. So the HM services, the core service for both grantees was a relationship education workshop. And the grantees offered somewhat different workshops. SHR offered a curriculum called Loving Couples, Loving Children, and that was about 24 to 27 hours of a workshop. And then the home program offered a tailored version of a curriculum called Within Our Reach, which was about 18 hours. Each program also offered what we call job and career advancement services. Both of them offered a standalone workshop that covered this content. It was about 2 hours. And SHR also integrated 4 hours of material into their core relationship workshop. So even if the couples chose not to engage in these standalone workshops, they were getting some exposure to that content through the core workshop. And then both programs also offered one-on-one services with an employment specialist, and that could be something like help with developing a resume, doing a job search, that sort of thing. So again, our primary research question was what are the effects of these programs? And we looked in multiple areas again. Almost 1,600 couples enrolled. Both the male and female partners had to be interested in the program and consent to the evaluation. And then they were randomly assigned to either the program group that could receive the services or control group that could not. As with RF, we had 3 data sources. It was different surveys, but there was a baseline survey. Men and women were interviewed separately, both at baseline and 1 year later. And then we had the NDNH data, that administrative data for the couples as well, each person. Again, we did a careful thought exercise of what do we think these programs are going to, what are they likely to affect, and we selected 12 confirmatory outcomes in 3 areas before we did the analysis. So we were looking at parenting, healthy relationships, and job and career advancement. Again, just to give you a quick snapshot of our couples, they were in their mid-30s on average. They had between 2 and 3 children. About 59% were married at the time they enrolled in the study. 78% were Hispanic or Latino. Most of the men had worked in the past 30 days when they entered the program, about 80%, and about half of the women were working during that same time frame, a little less than half. And on to the impacts. So these programs had a number of favorable effects on relationship quality. They improved the level of commitment each partner felt to their relationship. They improved the level of support and affection partners felt towards each other. So that could be intimacy, the friendship they felt with their partner. And it decreased the frequency of destructive conflict behaviors. So again, that could be things like name calling, contempt, criticism, defensiveness, things that can be very hard on a relationship. So that was reduced in our program group relative to our control group. The programs did not, we've lost the slides. There we go, thank you. The programs did not increase the frequency of constructive conflict behaviors. So it was a decrease in destructive. There wasn't an effect on constructive. And it didn't have an effect on relationship happiness. There was an effect on relationship status. The couples in the program group at the follow-up were more likely to be married. 63% were married at follow-up compared to 59% of couples in the control group. So that's a 4 percentage point difference. Not all of the couples were married at the beginning, so we are also interested in whether this effect was being driven by couples staying married or couples who weren't married getting married over that year period. And what we found was that this impact was largely driven by couples staying married. So they were less likely to divorce and separate if they'd been offered the program in that year compared to the control group. We also expanded the definition a little bit to look at just whether they were still romantically involved. So that could be whether they were married or still in a steady relationship with one another at follow-up, but there wasn't an effect on that outcome. We looked at co-parenting. All of the couples had children, and we again wanted to see how they felt they worked together in parenting. And we found a favorable effect of the programs on co-parenting. So both partners felt that they worked better together after that year if they had been offered the program. The effects on job and career advancement were a little more mixed. We looked at, again, self-report and administrative data. The women in the sample reported higher earnings if they had been offered the program. So they were reporting about $100 more a month than women who were in the control group. But there wasn't an effect on earnings when we looked at the administrative data. They had similar earnings according to the administrative data. And there are several reasons why that might be. I think perhaps the most compelling is that the administrative data doesn't have, you don't have a record if it's informal work, if it's part-time work, so they wouldn't be in the records there. So it may just be that women were more likely to be doing part-time work, and that's where the earnings were coming from, and that's what they were reporting. The programs did not change men's monthly earnings, and that was when we looked at both self-reported data and the administrative data. So in sum, I think it's, again, a really positive message that the Healthy Marriage programs improved multiple aspects of the couple's relationship quality as well as their marital status. We were also looking at other HM programs, the research on other HM programs. As Robin said, ACF has funded research of healthy marriage programs for a while, so we're able to look at a broader context. And we find that the PACT results compare favorably. They're similar levels. Actually, the effect on marriage is a little unusual. We often don't see that, so that's pretty noteworthy. But there was more limited success with the job and career advancement. And I think we can speculate why. There are a couple of reasons that may be. Combining these two services, relationship education and job and career advancement, it's pretty new, and I think we're still trying to figure out how the best way to do that. I think also compelling is that when we asked couples when they enrolled why they were enrolling in the program, and most of them did not say job and career advancement. They were there because they wanted to improve their relationship. So that was not a prime motivator for them to engage in the services. And then I think, unsurprisingly, we found that only half of the couples actually received job and career advancement services. So it wasn't their primary interest, and it wasn't a huge take-up rate of those services. So just in closing, I just want to say that this ACF really conceived of PACT as a way to get the field talking, to help us move our knowledge base forward for funders, developers, practitioners, and researchers to really think about what we're seeing so that we can help the next generation of programs. And I think what we've seen in PACT is there are both important successes and there are areas that still need improvement. We didn't find effects on all of the outcomes that we examined in all of the areas. And so those might be places where we need to bolster services or think of different approaches. And the hope is that eventually that these findings will help support future program development. That's all I have. Thank you.
you're on. Well, as we begin, we're going to ask Mr. Halbert Sullivan to start with his comments about his perspectives on responsible fatherhood program.
Good morning, Robin. I want to thank you and OFA ACF for this opportunity. The findings were rather interesting for us. We've been around for 20 years, and we've always thought that we did an outstanding job. To learn the areas of our weakness will help us to make some changes in what we do, because we do want to always consider ourselves to do an excellent job. The finding that stuck out the most for me was in that area of increased earnings. For 20 years, we've had workforce development involved in what we do. Time spent is valuable, but for a father, that job is also valuable, and that he gets an increased income. So what it caused us to do is to spend a little bit more time with him in our program, leading him towards education, training, so that we can impact his earnings. There were other areas that of note. 2 years ago, we started a program where we wanted to increase the co-parenting. So now with the findings coming out, we see that we're on track, but we also have experienced the difficulties in increasing the co-parenting agreements. Now we will dig deeper down and create more activities, whether it be the both parents, our parents are never married, none consider your parents, whether it be the both parents in group activities together, or whether we seek out one-on-one therapeutic opportunities so that we can lead to more increased co-parenting engagements for our fathers. The project, it gave me a new perspective on research. I personally have always had questions centered around the research, the value of it. Human beings are not widgets. They'll be this way one day and another way another day. However, as we look towards the furthering of our field, we need to be able to gather certain information, valuable information, not only for my agency, but for the nation, so that we can learn how to help in programs to improve that work in this field of empowering our families. And so the research process itself was very, very well conducted. The team came in and they helped us to set up the way we collected the data, which also gave me some new insights into preparing our intake sheets, following up with what we prepare, and to come up with better assessments and assessment tools. The frequency of the intervention at that time also helped us to improve our interventions. We had frequent interventions with the PAC team, and as a result, I began to look at how often the staff intervenes with each other, and not just for purposes of having a meeting to discuss how many clients you had in, but to come together and discuss what are the issues that our clients have been telling us about, and how can we formulate ways to solve those issues. Then there was the trainings that we got, which also added to my knowledge the importance of having some type of frequent training opportunities. We had been doing certain things, but it was not structured things. One of the things that we did very well, and we continue to do well, is our recruitment piece. But we didn't do too well, in my opinion, on retention. We would lose about 50% of the people that came into our programs. I wanted to capture more. So the training piece on recruitment became very important for us, and the frequency of trainings and retrainings. Once a year training is not enough. The people that we work with, they bring in a lot of problems, a lot of barriers, a lot of concerns. My staff, I got the best staff in the country. They're very committed to the work that they do. And sometimes they can get absorbed into the work that we do. The frequency of training centered around the valuable components is more important. That way, everybody stays on the even keel. We want to be able to retain more. In a sense, we have some very different thoughts about the population, particularly in the area of parenting and co-parenting. We think that the guy, he's got to want to be in the program. And what some of the findings taught was that most of them come to the programs because they want to be involved in our child's life. And that is the most important piece for us, is that he want to be involved. We do have those that will come. In Missouri, we have a very high success rate in employment. We currently get about 65-70% of those who complete a job, and they hear about that, and they come for the job. Well, that's a good reason, but that's not the only reason from our perspective. The other reason is that he becomes emotionally, psychologically, and have an impact on his involvement with his child so that the children can get a better shot in life. As we continue down the journey of what did we learn from the study, basically structure. I started out as a small charitable nonprofit doing great things. While we paid some attention to structure, because as we went, we began to get federal or state grants, city grants, and they all bring about structure to you. The value of structure and policy has to come from inside, and it has to come from the top down. It has to stay the primary concern, is that we have a structured work environment. You'll learn that your fathers, your participants, will also benefit from a structured environment. All of us benefited because we had structure, either completing high school, completing college, or in our homes. Most of the homes that they come from, there is no structure. My time is up, I see. He's holding signs up.
Thank you. Scott, helping him?
Thank you, Robin. I appreciate the opportunity to comment on the study, and I'd like to try to put it in some sort of clinical historical context. So many issues these days, relationship education has become a political hot potato and really swept up in a lot of ideological debates. And I think there's studies like this are needed to really make it more data-based so we can really address its effectiveness and impact. So I appreciate the opportunity. The rationale for relationship education is impeccable in my opinion. It dates back to Daniel Patrick Moynihan's observation of the fracturing of family structure among low-income families. And there are a number of important findings that families without father involvement are much poorer than those with involved fathers, that the best predictor of father involvement with his children is his relationship with the mother, whether they're married or unmarried, and that if parents stay together, fathers will contribute more financially and emotionally to their children. So I think the rationale is really impeccable. So when the funding, when Wade first got the funding for the program, we thought we should apply. Because we're based in the Bronx, and which really has an extraordinarily high rate of poverty, and where only 1 out of 3 families is married. And we thought it would be a very good testing ground for the intervention. And really the question was, can relationship education skills be taught? And would there be any interest in these services? So we participated in that first wave of relationship education. And I guess there were 2 basic funding streams at that time. One was the Supporting Healthy Marriage program for married couples, which is the one I participated in. The other was Building Strong Families for unmarried couples, which I was not part of. I guess Mathematica did the study on the Building Strong Families study. They had 5,100 couples recruited overall. And at that time, the finding was that there really was not an impact on a whole range of relationship education, relationship outcomes. And I think part of that is because having something to do with the way research studies are conducted, 45% of the couples that were included in the data analyses did not attend a single relationship education workshop. And 83% of those that were included in the analyses really received what I would consider an inadequate dosage of the intervention. So, so really to say that that program really didn't have an impact, it's a little bit like saying that exercise really doesn't make us healthy if we do not go to the gym. To me, that all that the BSF study really showed was that there really wasn't a lot of interest in the program at all, and that would probably be true if the government gave away free gym memberships also. I'm not sure that a lot of people would go, but I'm not sure that's really the key thing. I find it interesting, there was one BSF site in Oklahoma City, which really did have actually enhanced financial incentives, and they had very good attendance, with 80% receiving about over 24 hours of education. And lo and behold, that was the one site where there was a real significant impact on a whole range of relationship outcomes. So I think that's important, and it shows that this really isn't just a manualized intervention, that each site delivers their services in a different way, and I think that's going to impact the impacts. The study that we participated in at the time, the Supporting Healthy Marriage, was conducted by MDRC. It had actually much higher financial incentives, had much better attendance. In this case, 83% attended at least one workshop, and a majority completing the full course. And in fact, they found a modest impact on relationship quality, relationship satisfaction, reduction in conflict, and positive communication after a 1-year follow-up. My opinion, had they limited the analyses to only those couples who'd attended the services, they probably would have had what we consider a moderate impact. So that brings us to the second wave of funding, the PACT study here. In this case, we have the married and unmarried couples were commingled into the same workshops. There wasn't a distinction between them, and we were part of that study. Our site had very strong recruitment for the PACT study. We had 1,022 couples that were covered over 21 months, which is really quite a high rate. It was actually, I think, double the Texas site, so it shows there's a great interest in the Bronx. Our couples were really underemployed a lot, and I think that might actually relate, Sarah, to the fact that there may be some differential impacts on the earnings that occurred. And also, our couples' families were much more likely to be blended families, with an average of 2 children with other partners in our sample. I think that's an important point, because there really isn't and shouldn't be a hard and fast distinction, in my opinion, between relationship education programs and fatherhood programs. To some degree, we're all doing the same thing in one way or the other. We had pretty good attendance in our group. We had about 18.4 hours of participation in programming, which is not quite as good as we had in the Supporting Healthy Marriage program, but still I think was sufficient to find a significant impact on the outcomes that Sarah reported on. I'm especially impressed by the findings on commitment, on co-parenting, the reduction in destructive conflict, because these are exactly the areas that we do focus on, and we would expect to see an improvement. We spend in our program about 50% of our time just talking to couples about how to protect their relationships from destructive anger. We use John Gottman's curriculum, but regardless of which curriculum I think anybody uses, I think the common thread in all the curricula is this focus on helping couples deal with conflict in a more respectful and constructive way. Conflict is endemic to all relationships. It's how you deal with it that matters. As a clinician, what I observe in the couples in our program as they enter these workshops is there's a pervasive sense of bitterness at a long list of perceived betrayals, including infidelity, in a disproportionate number of the couples, and a cynicism that the quality of the relationship can or will improve. What improves during the course of the workshops is that the couples learn how to talk to each other around difficult conflictual topics, and in doing so, the conversations restore a sense of trust and hopefulness about the relationship. One of the things I found in particular was the men particularly enjoyed coming, even though generally it was the women that brought their men in. The men really enjoyed it. And I think one of the reasons they enjoyed it was that they tend to find that their partners over-talked them. They were better at talking, and this gave them an opportunity to learn how to talk in the workshops that we held. I want to turn to 2 quick issues in the little bit of time I have. One is the issue of employment services. It really doesn't make sense to me to have a split-off section on employment. It really is something that runs through the entire course of what we talk to, because financial support of the family is critical to family security. So it's something that's key there. The second thing is that Sarah reported on overall findings in earning power between the 2 sites. Actually, in our site in the Bronx, where actually there was greater unemployment, I think, than in the Texas site, there actually was a considerable impact on fathers' reported earnings, as well as on the administrative records of their earnings, as much as $259 a month as a result of the program. So I do think that it shows it really has an impact. Thank you.
Great. Thank you. Dr. Hort, both.
Well, thank you, Robin. It's a pleasure to be here today. At my age, of course, it's a pleasure to be anywhere. I would like to take a moment, though, just to note the passing of a giant in the fatherhood field this past year, Charles Ballard, who was really a pioneer for all of us who have been working in fatherhood. And so I just wanted to make a quick note of that and an appreciation of his contributions to the field. Well, it's been over a decade since the Deficit Reduction Act of 2005 provided for the first time dedicated funding through the federal government for responsible fatherhood and healthy marriage programs. And from the beginning of this program, there was a commitment to serious program evaluation efforts to understand what works and what does not. Now, I cannot think of a single other federal program that has not just committed from the very beginning to a rigorous evaluation of the impacts of the programs, but has continued to have that kind of emphasis as the Responsible Fatherhood and Healthy Marriage program has had. And the point of this was never to determine whether these program efforts should continue or not, although some have suggested that based upon early results that it should have in fact been discontinued, but rather to help improve the program design and overall effectiveness of the efforts, particularly through a systematic analysis of program implementation, outputs, and outcomes. So that brings me to the results that were released today. So first, when it looks at the fatherhood programs, what's interesting to me is it seems that the greatest impact are on behaviors that are most directly under the control of the fathers themselves. So these are things like reading books to their children, working on homework with them, showing patience with them when they're upset, encouraging their child to talk about their feelings. These are behaviors which the father largely has direct control over. The program had less impact on things that are more dependent upon the actions of others and not just the behaviors or actions of the fathers themselves. So the amount of contact that they have with their child, the amount of financial support that they provide, the amount of earnings, and the degree to which they have developed a good co-parenting team. All of these are things that are clearly impacted by the father's behavior, but not solely impacted by the father's behavior. What that seems to suggest to me is that if we want to have impacts on those behaviors and those outcomes, we're going to have an even greater focus on the larger ecosystem within which the father interacts. They're going to have more focus on working with employers directly, working with the courts, and working with the mothers of the children if we're going to have impacts or expect impacts on those kinds of outcomes. Now, when it comes to the Healthy Marriage Program, Scott did a very nice job of sort of highlighting that at its conception, there were three different models: the Building Strong Families model, Supporting Healthy Marriage, and Community Healthy Marriage Initiatives. The Building Strong Families, as Scott indicated, was really focused on working with unmarried couples. And Supporting Healthy Marriage was focused on working with already married but low-income couples. And Community Healthy Marriage Initiatives were kind of doing everything you could think of all at once within communities. This particular evaluation, this program, seems to have melded a bit some of these models so that only about 60% of the couples were married at the time that the intervention began, as opposed to under the Supporting Healthy Marriage model, at least as initially conceived, it was going to be only married couples. But having said that, it is, I think, impressive that we saw some positive effects on very meaningful and important outcomes. Commitment partners felt towards each other, level of support and affection they provided to each other, frequency of destructive conflict behaviors, and so on. And also, what's interesting to me is that the impact was on staying married and not getting married. And if you look at the prior evaluations of particularly Building Strong Families and Supporting Healthy Marriage, these findings are quite consistent, in my view, with those findings. So building strong families, as Scott suggested or indicated, really did not have an impact on whether couples got married. And we see that again in this evaluation. And except for one site, and I see Mary Myrick is here, did one of the interesting things in the model that she implemented, in my view, is that she commingled married and non-married couples in the intervention whereas the other sites did not. And so it seems that perhaps what that did is it provided a real-life example of married couples to the unmarried couples, something that they could witness and see and perhaps want to emulate. And that is consistent with the kind of work that we saw here, which is that we had both married and unmarried couples. And so her positive impacts on those kinds of relationship outcomes are consistent with the kinds of relationship positive outcomes that are found in this study. Also, the supporting healthy marriage, I'm going to sort of challenge a bit the sort of prevailing wisdom that these were sort of weak effects. First of all, I'm a psychologist. I started my career doing therapeutic outcome studies. If we found positive effects that lasted a month, we threw wild parties. When you look at the Supporting Healthy Marriage Initiative, the couples were assessed both 12 months and, more astoundingly, 30 months after the intervention started. And at 30 months, they still showed significant positive impacts compared to control groups on things like higher levels of marital happiness, lower levels of marital distress and infidelity, greater warmth and support and positive communications, and less antagonistic and hostile behaviors. That's actually an extraordinary result if you think of 30 months after the intervention, those kinds of positive impacts are still being found. And I think that those are also consistent with the early results here in this study as well. So taken together and looking at all of the evaluations, it seems that it is possible to have positive impacts on some critical relationship skills for low-income married couples and perhaps also couples who are committed cohabiting relationships. But that the effects of marital formation, the evidence that we can impact that seems to be much, much weaker, if not even non-existent. Now, of course, there are other things government can do besides these things. For example, there are a lot of people that proposed, including former President Barack Obama back in his 2013 State of the Union address, that one of the things we ought to do is also look at reducing financial penalties, particularly for low-income couples if they decide to get married. Now, there's not a lot of evidence that actually financial disincentives impact marital formation, but it is certainly worth taking a look at. And I would encourage the program administrators to look at that going forward as part of this program as well. And then the other thing is that there's a lot of people who talk about the value of public education campaigns to encourage young people to complete their education, become employed, and marry before having children, and highlighting the benefits to children of having two involved parents. And that's a reasonable hypothesis. Now, I will tell you that we thought that the Community Healthy Marriage Initiative would do that kind of thing. And what we found is that it had no effect. But we also found that nobody in the community seemed to know there was any public education campaign going on at all. And it's hard for a public education campaign to have an effect if nobody knew or was aware that those messages were out there. So it still seems to me an open question whether that's going to be helpful. And I would again encourage the program administrators to broaden the lens and maybe do some additional work in that area as well. So I think that this study continues to add to a growing body of evidence of things that work and things that don't work. And that's a good thing. We should do more of the things that work, less of the things that don't work, and not simply throw up our hands and say, we didn't get 100% positive results, we should cease the program altogether. So thank you.
Well, thank you all for your perspectives on the findings that we have here. We do have some time and opportunity for questions, and if there are those of you who have some burning ones ready to to share with the panel. There are 3 mics. You may want to begin to line up to make sure that we have enough time for folks to be able to ask those questions. But I thought that I would start with a question as well while you're thinking and putting your thoughts together. This one I think I'm going to pose to both Halbert and Scott. When you think about what you've done, you know, we talk about things like is there a secret sauce? Is there anything specifically that you would say that helped you contribute to the outcomes, the findings that were there, and how it made such an impact on the lives of couples or even the fathers themselves, whether it's the setting, whether it's the way the program, the structure of the program? Are there 1 or 2 things that you all can share with the group about what you think that might have been?
Very briefly, I talk to lots of people all over the country regularly, and that question is always asked about the secret sauce. It's not a big secret. It just depends on whether or not you and your team wants to do some work. We work primarily on changing attitude and behavior. It's a therapeutic process that we put in place that is supposed to assist with this human being changing their cognitive, changing how they think about themselves, their role as a parent, and their role in their community. We capture several areas in our processes of trying to change perception, attitude, and behavior. It's very intense. Guys come to us, well, now we work with moms too in our co-parenting agreement, 5 days a week. Not 3, not 2, 8 o'clock to 4 o'clock. Not 1 hour, not 2 hour. 40-hour work week, 5 days a week for 6 weeks. We employ family therapists, social workers, parenting professionals, and our facilitator recruiters, as well as we have a legal team. Now, all of these supports are not paid for under OFA's dollar. I want to make sure you understand that, okay? Because there's certain things that I've just said that you cannot spend their monies on. However, we feel that it is valuable that you first make the effort, first, before getting a job, before anything, that you make an effort to change attitude, thus changing behavior. And if you want to know more about the secret sauce, give me a call. But that's the primary effort that has to go into it. You've got to understand that the populations that I work with, their environment and their circle is vastly different than what you think yours is. The way they think, their perception of situations around them is vastly different. I heard one of the speakers say earlier, we put it on his shoulders. It is your responsibility. Yes, we have structural racism, we have all these other kind of things going on, but what is it that you can do right now? Once you can get that taken care of, then we can have some more conversations about these other stuff. But we need you to get involved with your family. And that takes a process to get him to participate in changing his perception of his situation and changing his attitude about that. And it's intense. 5 days a week, 8 o'clock to 4 o'clock. I've been doing this for several years. I have several friends. Well, you can't do that. You can't. That's what I'm going to do. I've been doing it for 20 years. It works. They come out from our programs. They stay engaged longer. They're more committed to trying to put together co-parenting agreements longer. They're more committed to staying involved with us. If you stay involved with us for that year, that's when your income, because we focus on income. We have social problems and we admit to that. But the biggest problem is an economic problem. How do we address that? We got to help this person to change the way he thinks about education, the way he thinks about training, and the way he thinks about pursuing income. So it's valuable to spend some time with changing attitude and behavior.
Great. Scott?
I would say we try to make it as fun as possible. We have 15 couples in each workshop that we do, and they stick together for 10 or 12 weeks together. And so we really try to, there's a lot of joking around, there's a lot of group support. And I think that what ends up happening is people look forward to coming to it, and then next thing you know, you've spent 20 hours in this, and there's a real commitment to it. I mean, it's not 8 hours a day, 5 days a week, but there's a sense of I really must value this relationship if I'm spending this much time talking, because most people don't talk about their relationships; they just sort of do things, sort of reflexively. And this, where we force them to think about what can protect their relationship from destructive conflict.
And so one thing that we do understand about the secret sauce is that there is hopefully another round of competition, and you all don't want to share everything that you do with everybody about how you made that. But thank you for those points. I do have one question I'd like to pose to Dr. Horn about that, around the economic the piece, the outcomes that we didn't necessarily see the way we had hoped or would like. But would there be any things that you would say with regard to policy that we could do differently to think about maybe moving the dial on that aspect of our programming?
So one of the things I found interesting in the presentation is that that the couples were not listing as the primary reason for coming to the program career advancement or employment, greater employment or greater earnings, and so it was fascinating to me actually that what they were mostly interested in was the relationship education and the relationship skills training. I think that speaks to one of two things, which is either that wasn't a big issue for them, or that the desire to have a healthier relationship with each other was really the overriding concern. And so they said, oh, and by the way, we also do this. And not everybody even availed themselves of that. So then we say, well, we didn't find impacts on it. Well, I'm not too surprised by that. I think that if you're going to get more economic impacts, that I think that it will require two things. One is making it much more clear in the recruitment that this is a big piece of what we're going to do. This is like, they're inseparable. And I'm not sure that's a great thing, by the way. But if you want impacts, you're probably going to want to have to do that so that you're getting couples that want both, as opposed to couples that want just one. And the second thing is, I think that I don't know the degree to which there was a lot of work with the employer community in these programs, but my experience with welfare work programs is they don't work great if you just say to people, go find a job. They work better if you're also working at the same time with employers and helping to match recipients to employment opportunities that are in the community, and then helping work with employers to help them, further their employment status. So those are the kinds of things that I think about.
Great, thank you very much. We're going to open it up to the floor right now. If again, there are 3 mics. If you're wanting to ask a question, go ahead and gather. We have one been waiting patiently.
Thank you, Robin. Alan Hawkins, Brigham Young University. A quick comment, and then I think 2 quick. Well, I'll limit myself to 2 quick questions. I've got many more. Mostly, I guess, to Sara. When will the reports be released of these findings?
It should be very soon. It's not entirely up to me. It has to go through a clearance process, but it should be very soon.
And maybe it's really more a question for Robin. Are these reports, will they be available very soon?
It's a little bit higher on my pay grade to answer that question, but OPRE is working diligently to get those.
So it's a question for Naomi.
And Naomi.
Actually, could I just...
Thank you, in a few days.
And I just want to say the slide deck should be available on the app, and it has results that I didn't present, the numbers.
Okay, that'd be worth
the
looking
impacts.
at. I guess 2 quick questions then. Can you characterize generally the magnitude of effect sizes that we saw here and in these programs? Both the Responsible Fatherhood and the Healthy Marriage programs. And were they generally consistent across sites, or did you find some important site differences?
So it's hard to characterize the magnitude of the impacts because there's so little research on fathers. I'll start with fatherhood. So we were trying to find broader context to say, how does this compare to other evaluations? And there's just very little research on fathers, particularly on very disadvantaged fathers. So I would say it's hard to find a benchmark to say, this is an important, large effect. They were statistically significant. I would say they tended to be, so for example, the employment effect that you saw on employment stability was 2.07 for the program group, 1.97 for the control group in terms of consecutive quarters. That translates to about 1 in 10 men working one consecutive quarter longer. So that's one way to think about the magnitude of the effects. For healthy marriage, as I said, they're very similar to the size of effects from other research on low-income couples. Again, I think this is a challenging population. They have a lot of barriers, but they were able to improve their relationship in, I think, meaningful ways. And the effect on marriage is unusual. As I said, it was 4 percentage points. We don't often see that in other research of programs of low-income couples, so I would say that was notable. In terms of the site-specific effects, there were differences in sites, yes. We do talk about that a little bit more in the report that will be coming out probably next week. So you can look at that for more information. And as I said, the slide deck does have the site-specific results, so you can see those as well.
Great. Any other questions? And I should also remark that those who are live streaming can also ask questions and submit questions as well.
Hi, my name is Kriti Jain, and I'm from the Office of Planning, Research and Evaluation. And I wanted to follow up with Mr. Sullivan about a comment that you were starting to discuss as your time ended. And I wanted to hear a little bit more about the process of structure and adding structure and what that evolution was like. And so I was hoping that I could ask you to speak to that a little bit more.
Structure and adding structure, policies, procedures, they have a place, and they're not just to be written and put up on a shelf. I'm talking about structure for the agency, structure for the staff, so that staff knows how to connect A to B and B to C. We have a significant amount of moving parts in our organization. Sometimes things can be determined by way of who's funding what. And that is very important, so you got to keep that in its own perspective. However, what is more important to me, will our clients get the things, the services that we determine will help to change attitude and behavior and will help to have him be a good impact in his child's life. So there's another layer of structures that must occur at the same time. Mm-hmm. And sometimes it can be a little overwhelming for staff. So therefore, to put the structure in place and then to continuously have some type of in-service trainings and or bringing in outside professional trainings helps to ease the staff's anxieties about so many moving parts. Mm-hmm. We offer what we call a comprehensive, holistic array of services and the approach. It is also done through a cohort method, not this day, this person, this day. You come in as a group, you leave out as a group. And so there are a variety of things that go on at the agency to be able to structure so the staff can get a wraparound. Mm-hmm. We work with the information system Inform, but we also have our own in-house called Apricot system. And that performance management tool allows us to be able to check and make sure that our structures are being adhered to, policies are being adhered to, and that we're leading towards the outcome that we wanted to pursue from the beginning with each individual.
I'd just like to piggyback on what Howard said. We try to teach structure to the couples. I wouldn't say we use that word, but one of the main skills we teach is something called speaker-listener skills. And it really means having a role that, okay, now you're the listener and that's your role, and it's not to be speaker and react. And it's interesting because actually listening and paraphrasing is a much more difficult skill than actually speaking your own mind. And so it's something that we explicitly say to couples, this is your role. It gives them a structure so that they're not so reactive and emotional at that moment. They have to be a little bit more intellectual and cognitive and structured in their responses.
Does that help with your question?
Yes,
That's a
thank
very
you.
important question for those who are providing services.
We do have one live stream question here.
This question is for Halbert as well. Do you believe that improving a father's income through employment placement has a positive effect on his ability to parent?
Would you repeat that question, please?
Do you believe that improving a father's income through employment placement has a positive effect on his ability to parent?
Most certainly I believe in that, but that is only one element of the thing. But I would say from a man's perspective, men love their children as much as women do, and their money allows them to do what men like to do. Men are doers. Okay? They want to be able to provide. We're providers and we're protectors. So without any income, he won't go around to be with the child to participate in the parenting process and on any co-parenting arrangement. So yes, income is very important from my perspective.
I have a question for Sarah, but maybe the others can comment on it as well. In these evaluations, are you actually measuring child outcomes? And because I oftentimes in these multi-generational interventions, we've actually found bigger effects once you actually look down at the child level than you actually can measure from the adults themselves. And so I'm just curious whether you're measuring it or planning to measure it, and also maybe whether the practitioners can comment on, you know, what they're hearing or seeing about the impact of these programs on children.
So it's a great question, and one we discussed extensively when we were planning the evaluation, because ultimately the goal of the programs is to help the children. We decided not to collect data directly from the children or from the mothers. The services didn't usually include children. So I think also you have to think about the length of time you would expect to see impacts on children. It would have to be indirect through the parents, either through the couples or through the fathers in the Responsible Fatherhood program. So it might take longer to manifest, and we were doing a one-year follow-up. And we decided to focus on the people who were actually receiving the services. But it was discussed extensively, because ultimately the hope is that the improvements in parenting and relationships translates to improvements for child well-being.
I think that's a really great question. It is one that I have been contemplating for at least the last 10 years, how to pull off a longitudinal study where we look at what has our impact been on our children. Fortunately, about 2-3 years ago, it became a little bit more serious for me. I have a PhD at Brown School of Social Work, Dr. Sean Joe. It is also an area that he's interested in, and we are in deep discussions putting together the longitudinal type of study over about 5 or 10 years to look at it. And we want to put it in place in 3 different places. I don't mean to knock anybody else, but I do know there are at least 2 other great fatherhood programs, one in Baltimore and one in Indianapolis, and we've been in discussion about trying to pull together that type of a study so we can see what the impact is.
The Supporting Healthy Marriage study that was conducted years ago looked at this question, and they looked at 30-month follow-up, and basically you're not going to be able to find an effect. I think there's such a dilution of the impact, and there's so much variance in this. You have different age children you're focusing on, and I think it's going to be next to impossible to find that in a research study. Though I'm convinced, without data, that there is an impact on the children.
Hi, Jay Fagan from Temple University. So this is a question for Sarah, but before asking the question, I appreciated, Dr. Horn, your comment that the things that changed in the Responsible Fatherhood, part of the Responsible Fatherhood study were those things that fathers had some control over. And, perhaps they don't have much control over contact with their children, particularly if there's no change in the co-parenting relationship. So that it may be difficult to have more contact if the co-parenting relationship doesn't improve. That being said, there are different types of contact. There's face-to-face contact, and then there is a contact by cell phone, by social media, et cetera. And we're finding in the data that we're collecting with low-income non-resident fathers that these are not highly correlated, that face-to-face contact is not highly correlated with other types of contact, particularly cell phone contact. And that is something that fathers have more control over when perhaps the co-parenting relationship is not a healthy one. So my question then, sorry, it took me so long to get the question here, but my question is, how are you measuring contact? Have you separated out some of these different types of contact?
It's a great question, and one, again, we talked about a lot. So we looked at multiple forms of contact. What I presented here today was in-person contact. Basically, after talking to experts and the grantees and thinking about the goals of the program, it was decided that was sort of a better indicator of what the programs were trying to achieve, right? Yeah. Keeping the fathers in person with their children. But we did look at non-in-person contact as well. It's in a supplemental analysis. I don't actually have it at my fingertips right now. So we did look at that as well because we had that same thought. If the mother is not comfortable with him seeing the child, then he may be able to reach out in other ways. Right. So we looked at that as well.
Yes, absolutely. Face-to-face contact is really important, but I wouldn't undermine the importance of the other types of contact that fathers can have with their kids. I think they really are important, and be glad to share some of our findings with you.
Okay. We have time for one more question. So if you make your way to the mic.
Thank you. This will be a simple question, but not easy. My name's Frank. Myself and my colleague run a workforce development program in Cleveland, Ohio, small nonprofit. And I would love to know, maybe from more of the practitioner point of view, how, give me something, some little sauce, a little parcel that I could walk away with understanding how you can keep your clientele coming back to your classes every day, especially all day long. That's our biggest struggle. And I know I've heard this from time and time again from other employment folks. If you could share any wisdom on that, on how do you maintain attendance in your programs?
That's the purpose of the talk to me later.
Oh.
Sports, right? Men love to be challenged. They love to develop a camaraderie, but they love a great challenge. One of the biggest mistakes I think people make is that those who are in impoverished condition are sitting around waiting on someone to come and save them. That's not true. When you come every other day, they come Monday, they come back on Wednesday. Well, what are they doing on Tuesday? They're doing some of those things that the impoverished population does. So to look forward to have something to do day by day is very important. But again, let's talk about this.
I would say that we have good attendance, and the first time people come in, I think it's for a whole host of various different reasons. But they keep coming in, I believe, because they feel that it's effective, that it's not a waste of their time. And they may be surprised. It ends up having an impact on them in ways they didn't think it could or they didn't anticipate. And so they might have been dragging their heels when they came in the first time, but then they're happy to come in subsequent times. So you have to have an impact. In our case, we actually have the workshops are all led by doctoral level clinical psychologists. And my feeling is that they actually are more skilled at being able to turn these workshops into something that feels effective and also that doesn't deteriorate into some, either waste of time or worse, some sort of, fighting or blaming or scapegoating.
If I could just add one last thing. So back in the 90s when I was running the National Fatherhood Initiative, one of the insights back then that was very, very helpful was, and may sound so much common sense today, but was that you have to structure programs for men different than structure for women. And that I know it's not popular to say this these days, but men and women are different. And you have to structure your programs differently. And so if you say to most men, here's our program. We're going to come in, we're going to put you in a circle, we're going to talk about your feelings and have a good cry. Most guys, find something else to do. And so There's a wonderful program back in the 90s called Boot Camp for New Dads. And the inside this person was a medical supply salesman to hospitals. But he got really convicted about helping men. And so he decided he would structure a in-hospital program after a child was born for men. And so what he said is that the men have to come, and they have to come with their babies, and the mothers can't be there. He said, because I know it's going to happen. The mothers are there, they'll all be in one corner with the babies, cooing with each other, and the guys are over in the other corner talking about sports. So he said, you had to come, and the women can't be in the same room, and the guys got to be there. And they structure the entire program around talking to men in language that connects with men. And he has this great videotape in which he shows men how to change a diaper. So they're trying, and they got their babies there, so they're all practicing. And he says, when you're all done, you fold it like this, and you fold it like this, and then it looks like a football. And then you throw it into, and I just think that, you got to think through how do you structure these programs in a way that's going to connect with men. And that's going to be a little bit different than the way we structure programs for women.
And there we have it. After 13 years of doing this work, I have to say that this is one of the most exciting days that I've experienced. And I thank Dr. Horn for his leadership in bringing this to be the programs that have done all of the hard work. Mathematica certainly, and OPRE for helping us refine and dig and come up with these findings that make a difference in the lives of the people that we serve. So thank you very much for your time and attention. We'll see you soon.